This is the Horse Radio Network.
This is episode 960 of Horse Tip Daily. A different horse tip, a different equine topic, a different equestrian expert every day. Horse Tip Daily brings the world of equine knowledge to you, one day at a time. Greetings, horse people. Coach Jen here, and thanks for tuning in to Horse Tip Daily. Today's tip is an excerpt from the Horses in the Morning show. Dr. Fugaro joins co-hosts Glenn and Jamie for a chat about the transmission, symptoms, and treatment of equine protozoal well, it's a real tongue twister of a disease that you and I know as EPM. We'll get right to our tip after this important message from Kentucky Performance Products.
Hi, Glenn the Geek here from the Horse Radio Network, and I'm here with Karen from Kentucky Performance Products. We're going to talk about omega fatty acids in equine nutrition.
Called Contribute. That is it's a combination of fish oil and flax oil. And it provides a complete complement of omega-3s. Okay. It has an 8-to-1 ratio of omega-3s to omega-6s, and it contains the plant and marine sources of omega-3s. Now, there's been some palatability issues with fish oil. I don't know if you've ever smelled some of the fish oils that are... Mm-hmm. Lots of horses will run to the back of their stall and just stand there going, oh, my God, Mom, what did you put in my feed?
Some of the human pills are like that, too.
Ooh, yeah, you can really taste it. So we did a lot of research with our product, and we got a fish oil that just on its own smelled pretty good, and then we've added some flavor, some cherry flavor to it that has made it very palatable. So we have very few horses turning it down. And like anything, you have to introduce it slowly, and should introduce it slowly anyway to the horse. But we have very few horses that will turn it down.
Well, that's terrific. It's good to learn. I never knew about the ratio between the 3s and the 6s. And, of course, you can find out more information on Kentucky Performance Products' new website. Has a terrific article on this, and we'll link to that in our show notes as well as on our Facebook page. Or you could just go to kppusa.com to find out more about omega fatty acids and the Contribute product. Just look under products.
Well, we're going to be coming up to our first guest. We got 2 health segments today, which is normally Wednesday is Health Day, and we have had some Wednesdays off from the health thing, but we had a topical thing come up, and that's EPM. It's been, Jamie and I read all the news stories that are going through the press that talk about horses and diseases and stuff, and EPM is becoming a hot topic again. So, So, Jamie, why don't you take the first one because you know a little bit more about this. I'll handle poop. You handle EPM.
Well, you're a great guy. And we've got Dr. Michael Fugaro, who is on the line right now. Dr. Fugaro is a professor of equine studies at Centenary College in Hackettstown, New Jersey. I've not had enough coffee this morning. And also a visiting instructor at Rutgers in the Animal Science Department. Good morning, Dr. Fugaro.
Good morning, Jamie. Good morning, Glenn. How are you guys?
Oh,
Good morning.
I'm going to try to wake up a little bit more because this is actually
you were
serious.
close. It's Centenary College. That's correct.
I had it. It's just too many vowels. You have been practicing large animal medicine and doing surgery for quite a while, and you run a practice up in New Jersey. And
Correct.
EPM is something we're talking about again. Why?
Yeah, I mean, it's a disease that's really never gone away, and it seems like, just like most diseases, that it's one that adds more challenges to both the horse owner and the veterinarian alike. And probably the most difficult challenge with EPM is making a true and accurate diagnosis. And there's a lot of misconceptions out there about the disease. But, there's also a lot of...
Yeah, for those who don't know what EPM is, they're just hearing it for the first time. What is it?
Yeah, EPM is equine protozoal myeloencephalitis, and it's probably one of the more commonly diagnosed neurologic diseases in horses, and yet the incidence of it is probably less than 1%. So from that standpoint, it's rather rare, although if it's your horse that gets a neurologic disease, you always hate to be the one. It's basically an infection that we see from a protozoa, and there are two protozoa that we see in this disease: Sarcoidosis neurona and Neospora, and there's a subset of Neospora that is. And this protozoa likes to live in a life cycle where it's basically between opossums, who's the definitive host, and cats and skunks, raccoons, armadillos, birds. They're the intermediate host. And it doesn't cause any disease in those animals, but this protozoa goes back and forth between these two species. And every now and again, as the opossum goes and defecates out on the pastures of the fields of the horse, then ingests the feces and specifically the sporocytes of that organism. And when it goes from the GI tract of the horse, it then goes into the blood, crosses what we call the blood-brain barrier, and gets into the CNS, specifically the brain and the spinal cord. And we see that, the numbers, we can see horses have positive titers in their blood, anywhere from 50 to 80% in terms of the number. So that shows that we have a lot of horses that get exposed to this disease. Not every horse actually gets the disease, and the horse cannot spread the disease. The horse is considered a dead-end host. They can't send it to another horse. So the life cycle only goes between those kind of scavenging animals that I mentioned before.
So are places that are heavier in possums, much like, I don't know, Belmont Park, which just had possums galloping along with California chrome?
When you get into the prevention of the disease, that is one of the things. We certainly see a higher incidence in those areas that are heavily populated, and you certainly increase your risk factors of being exposed in those. So absolutely, and there's all kinds of opossum control that people can do, from the simple standpoint of, keeping the cat food out of the barn so that the opossum in the middle of the night don't go into it. I mean, we have it at the college as well, that we are always dealing with other animals trying to get into our feed bins and things like that, and as well as kind of population control of those possums. So.
Right. Now, the symptoms for EPM, you said it's neurologic, and I've seen videos of horses just minorly affected, and or they are completely curved to the left. That it can be very dramatic. What are some symptoms that somebody that has just like a backyard horse would start to see if their horse had contracted EPM?
Yeah, it's really very variable. It depends on how much of the organism, how much damage occurs to the central nervous system. And it can be, the first thing that's kind of the hallmark clinical sign is we see that it affects one side of the animal more than another, what we call asymmetrical. So they may have muscle loss or muscle atrophy on one side. But you can have the whole host of neurologic conditions, from a horse that's down and can't get up to maybe some mild incoordination or stumbling. You can see other things, as you were describing, that would be cranial nerve, where they may have a head tilt or an ear droop or even a facial paralysis. And it can happen relatively quickly. Some people can describe that they haven't seen it up until, a few hours earlier on things. And then some of the more mild signs that we see, and this is where you get into the gray zone with the horse population, is lameness. It's always difficult to determine, okay, is a lameness a primary musculoskeletal problem, or is it maybe a secondary to this neurologic deficiency? And so this is where probably maybe some of the misuse and abuse of medications for EPM would come into play, because people have a lame horse. They can't find a reason for why the horse is lame. Okay, well, maybe let's treat him for EPM and see if that makes a difference. And there's probably a rationale for that to some degree. I'm sorry.
Right. Well, even without doing a spinal tap, people just go ahead and treat them. I mean,
right. So then that gets into the next part of the diagnosis. How do we diagnose this? And the first thing to say is that there isn't one clear-cut diagnostic tool to do. It's really a combination of several different things. There are clinical signs, the physical exam that the veterinarian would perform. Then the other thing is there are several tests that we can do. There's blood tests, and then you can take, as you described, spinal fluid. And you can get spinal fluid from two locations in the horse. One of them can be done standing in the lumbosacral area, which is back by the tail region, not quite the tail, but in that area, the pelvis region, that can be done. Or another way where it's up behind the pole of the horse, that you actually have to anesthetize the horse to obtain the fluid that bathes the spinal cord and the brain. And when you test the spinal fluid in combination with the blood, you get your most accurate diagnostic tests to determine whether it is. There's obviously expense, and there's potential, be it small, but complications of those type tests as well. So some people may forego the diagnostics and say, well, I'm just going to treat the horse as well.
Right.
And we as veterinarians really try to encourage a full diagnostic if we can do that. But certainly in the horse world, money also can dictate some of that as well.
Well, see, now the problem, and I think the reason we're talking about this right now is because there have been some horses that have been treated by compounded products, which are made in labs or compounding pharmacies, and they've had some adverse reactions and effects. Like horses have been dying on this compounded medication. Is that correct?
That's correct. There are 3 what we call FDA-approved drugs that are out there. The one is a sulfadiazine pyrimethamine combination that's put out by a company called Animal Health, or Rebalance is the name of the product. There's diclazurol, which is Protozoal, which is put out by Intervet or Shearing Plow, and then there's Marquis, which is put out by Bayer, and the actual compound of that is Panazuril. Those have all gone through the FDA approval. They've done clinical trials. They've looked at toxic doses. So if you're unaware of what it goes through to go FDA approval, it's quite stringent and rigorous and expensive for a company. Compound agencies are basically laboratories that make drugs that are not readily available, and they're used in the human medical world quite more than you think, as well as in the veterinary market. And they don't come under as much scrutiny. They certainly have various regulations that they have to follow. In the scenario that you're describing that happened recently, it was a combination of a couple of the different drugs that I mentioned there, but there is no commercially available combination EPM medication like that. And what happened was one of the pyrimethamine combination that they used in this was a higher dose than they normally do, which there are some veterinarians that are using the dose that they put that at, which is why it wasn't necessarily considered abnormal. But there were, I believe, and I don't know specifics of these horses. I read it just like everybody else, but the clinical signs varied from seizures to fever to death. I think it was a total of 10 horses. 2 horses passed away, and the other 6 were responding to, they developed neurologic deficiencies, and within the first 36 hours receiving the compound. And this is not the first time compound agencies have, made the media attention with it. And there is a place for compound medications. And, this is where you need to speak with your veterinarian and make sure that you're aware, and the veterinarians have to be aware of, what the medications are out there and what compound company they're using, and how much scrutiny they go under.
Well, no, and I have heard of using, and my vet back in Georgia, when I lived in Georgia, would prescribe compounded different things that would be like joint help, but I don't know if I would purchase compounded medication that would treat EPM. You got to be reasonable. Compounded bute is one thing. Compounded EPM medication, I would think that people would be a little smarter, and that veterinarians might not recommend this. I know it's illegal to buy some compounded medication here in Arizona. They have to have the approval from the FDA. Yeah. What is your take on it?
Well, I certainly use some compound products, and I try to only use compounded products that are commercially not available, which is what you're describing. If there is a commercially available product, we try to do that. And there is, you're correct, there are some legal ramifications of using a product that is already commercially on the market, and you are using it as a compound company. But I think a lot of what dictates why an owner or even a physician may prescribe this probably comes down to cost. And many of the EPM medications are costly. They can run a little higher than the actual diagnostic tests that are occurring. So I think a lot of the reasons why people will do that is because of cost. Now, on the flip side, there are some very, very good compounded products that are out there that are very safe and effective. But just like any other laboratory, and even the large companies sometimes get into preparation problems, and that's why it's really important that they have a good quality control of their products. Of course, again, the compound companies have come under a lot of scrutiny even since the polo ponies that occurred a few years ago with the overdose of selenium that was compounded at a higher concentration that was initially intended. And that was a laboratory error, from what I understand on that case, and it was an unfortunate scenario. But those errors can happen with the larger companies. It's less likely because they have a lot more checks and balances for that regulation. But that also comes at a cost, and that cost will then translate into what the client is charged to the horse owner.
So, being the veterinarian extraordinaire that you are, you've got a client that has a horse. I know we've got to let you go. You got to run, but you have a client that has a horse that is showing signs of EPM. What are you going to do as the vet?
Showing signs of EPM, I like to perform the blood test as well as the spinal tap as well. I have a certain laboratory that I like to use in those cases, and I typically only prescribe products that are FDA approved for EPM.
Okay.
That being said, I will tell you that in many of the show worlds, there are some products like the product Marquis that's put out by Bayer appears to have some anti-inflammatory properties as well, which have nothing to do with what the medication's used for. And so this is another reason why people will tend to use that, because it's a legal product to be used to be treating for EPM, and yet they can get anti-inflammatory properties out of it as well. So that's another reason why you see some of these products maybe overused out there.
Now, see, I got to let you go on that, but that's a whole other can of whoop-ass that we could open.
Sorry, I didn't mean to do that.
No. I would love to have you back on to talk about that, because that people are using these medications even in the race world, from what I've been reading, and using them incorrectly, and sadly there's always crooked people in every sport. So maybe we can get you back on to talk about that. I
would love to do it.
Oh, Dr. Fugaro, it's been a pleasure having you on. It's been so interesting listening to you. I feel lucky. The people that work with you are really lucky, because they get to learn a lot.
Well, thank you very much. Happy to do it, and be happy to do it again.
All right. Talk to you soon.
Thank you.
All right. Sorry, I didn't even know. I didn't even ask him where to go to learn more. I didn't even ask him what his website was. I got stressed. He was supposed to leave at 6:30. Jennifer, you had me a nervous wreck.
Well, there you go. As promised, you can find Dr. Fugaro at mountainpoint.com. You can listen to Horses in the Morning every weekday at horsesinthemorning.com, or even better, you can go to your app store for Android or iPhone and download the free Horse Radio Network app and have all of your favorite shows with you wherever you go. Just search Horse Radio Network in your app store. It's quick, it's free, and it's easy. This podcast has been made possible through the generous support of Kentucky Performance Products and listeners like you. To learn more about becoming an official auditor and qualifying for cool auditor-only perks, go to horsetipdaily.com and click on the Become an Auditor banner in the center of the page. The Horse Radio Network and the Horse Radio Network hosts are not responsible for statements of guests or their opinions. Use your own judgment when listening to the tips provided by the experts on Horse Tip Daily.